Hey, welcome back to the show, everybody. Is there a test for hereditary colon cancer? What are the indicators of hereditary colon cancer? What is known about hereditary colon cancer? Boy, a lot of questions to ask our next guest. As we welcome to the show, we wish she was on more often, Dr. Shauna Lorenzo-Rivero, a colorectal surgeon from University Surgical Associates, and Kristy Holcomb, a cancer survivor. We're going to get to you in a moment, and you've got something very interesting to show.
Something very interesting.
We're glad you're here. You know, we followed Barbershop Quartet, but you know what? We have a survivor here. That is happy news.
Absolutely.
And it can be very common to be a survivor if you catch it quickly.
Yes, absolutely. So colon cancer is treatable, beatable, but most important is preventable. So the reason that we're here is we now have the Greater Chattanooga Colon Cancer Foundation here locally in Chattanooga.
Which puts on the Rump Run.
Yes, in March, which is Colon Cancer Awareness Month. And one of our main missions is education. So while Kristy is a survivor, she's here to show you about that, but we want everyone to know, main thing is the average person needs their first colonoscopy at the age of 50. Yes.
And
good job.
I will be the first to tell you, it was painless. I've never, thank God, I've never been to a hospital before. I've never had an IV. And
really?
It was extremely painless. And the best news is everything was good.
That's what we want. And the majority of people, that's what's going to turn out to be the case. But we want to catch people who have polyps because it's much easier to remove them during colonoscopy than to actually wind up with a cancer, because then you might need surgery, chemotherapy, radiation, those kinds of things.
I think a lot of people need to realize, even 10, 15 years ago, you ought to be so thankful the technology is there these days.
Yeah.
You have the best nap of your life. Of course, the preparation is still not that enjoyable, but let me just tell you, getting the good news, that is enjoyable.
I would think that it's worth it, because it's really only one day out of your life that you're doing something for the rest of your life.
Doctor, let me ask you the question. We asked those questions about hereditary. Is colon cancer hereditary?
Now, there is an element of colon cancer which is hereditary. So less than 10% of them are truly hereditary. And then within that 10%, 1% actually have HNPCC, which is very specific, and we do have special tests for that. So we can test the polyp that we remove, we can test the cancer that comes out of the operation, we can test the blood for that. So first you have to have somebody in your family who had the cancer, like Kristy, and we can test her blood, and then we can test all her relatives to find out if they have those genes.
Let me ask you, in all the conventions you go to in dealing with colorectal advancements, is it going to get any easier, or is colonoscopy going to be the way it is even in 2013 and beyond?
Well, I think testing people may get easier, but if you think about a test that is also effective, there's nothing that beats colonoscopy.
Kristy, we're so glad to have you here, a survivor.
I'm so glad to be here.
And I'm going to let you go ahead and just talk about how long you've been a survivor and explain about your apron here. And you're going to stand up and demonstrate.
I will.
So go ahead.
I will. Well, let me tell you a little bit about my story first. I was diagnosed in 2010 at 43 years old with stage 3B colon cancer. All right? Because I was
Stage 4 is...
No, stage 3B.
But I'm saying stage 4 is...
Stage 4 is, well, the worst. It's when the cancer has metastasized to other organs. And even stage 4 can be treated. The cancer can regress, and you can be cancer-free with no evidence of disease, even at stage 4.
And thank God you are.
Yes, sir.
What do you got on?
Yes, sir. I have on an apron. A good friend of mine, she is a wound ostomy continence nurse. Her name is Joy Hooper. She has taught ostomy for years. And she said there has to be a simpler way to explain what's going to happen to you when the doctor says, besides you have cancer, you're going to have a colostomy, okay? It's enough to absorb cancer, much less colonoscopy. Here's a simple explanation. Food goes in your stomach, mixes with enzymes, then it goes into your small intestine, it goes through the area called the cecum into your large intestine, then it exits the body through the rectum, okay? This we know. What the surgeon is going to do, he's going to separate the large intestine, okay? He's going to sew one end shut. Well, if you have food coming in, you're going to have waste coming out, has to go somewhere. What the surgeon will do is he will cut a small incision in the front of your abdomen. He will take the end of your open intestine, bring it right through that opening, and he'll literally roll it over like a turtleneck, okay? Sew it to itself, sew it to the abdomen. So after surgery, this is roughly what the front of your abdomen will look like, and this is your stoma. Every ostomate has a stoma. They can be different locations, but they all serve the same purpose.
So that is what empties into...
This is what empties into the bag. You know the hardest part about ostomy? Finding shoes to match the bag.
I've heard that joke. That's a great one.
And it's the truth, Jed. It's the truth. Having an ostomy has hindered my life in no way whatsoever.
She will live a normal life with that. That will
Absolutely.
be... Wow.
Do you know there are Olympic athletes with stomas?
You did great, by the way. Thank you.
And she is a wonderful educator, and that is the whole point. Is if you have knowledge, knowledge is power, and you shouldn't be afraid of these things. It doesn't mean if you have colon cancer you're going to wind up with a stoma. That's a small percentage of people, and surgeons use them for different reasons. Just happens to be that Kristy has one.
You know what? You've got a tremendous gift as a doctor. Not only just your personality, but you are very friendly and patient warm. But this helps to have somebody come in and explain to the person, here is a person who's been through it, and not a lay person, not someone from the medical community, but that really made a lot of difference. And you know what? I'm sure you can get a grant to train other people to do this, some kind of grant. It just is so helpful.
Well, when I was diagnosed, my physicians told me every possible bit of information they could, but it's not the same as holding the hand of someone who knows, someone who's been there, someone who knows what chemotherapy feels like.
Where do you work? You're terrific.
I don't. I'm a housewife. Okay. I have been lucky. I've stayed home since the day my daughter was born.
Well, see, your whole family is lucky.
My whole family is lucky.
It's an honor to have you here, and I would love to get you back.
Thank
of course,
you so
we'll
much.
promote the run, and March is colon rectal month. Love to have you back anytime. And I'm going to suggest Latrice do a story on you for a health story.
We appreciate it.
Listen,
Thank you so
University
much.
Surgical Associates, I think the world of you. We can't put your screen, all the information up, but listen, it's right there, University Surgical Associates. And Dr. Rivero, thank you.
My pleasure.
Great to have you here. And listen, it's impossible to get on, so stop helping so many people and come on our show. We're back with more 3 Plus U right after this. That was